Hello, Mr. Beck.
Hello, hello.
Pleased to meet you. My name's Dr. Olson.
Good morning,
the,
Doctor.
The doctor's working on the assessment unit.
Yeah.
So I've been asked to come and chat to you about the results of the
Oh,
test.
yes, yeah, sure.
Okay. So if we just perhaps start by me asking you a bit about what brought you into hospital and what you remember of that.
Well, I mean, I had this sort of a collapse really at home. Fortunately, it was at home and not at work or anything. You know, the wife saw it, and apparently I sort of collapsed onto the floor. You know, I can't remember much about it, to be quite honest. And you know, so I understand I was there for a few minutes or so, and then I seemed to be coming round, and you know, she managed to, you know, after a little bit of a rest, she managed to get me to my feet, and she brought me to A&E, and I was admitted. And as you say, they've done all these various tests, and you know, I've had something called a scan or other. I'm not quite sure what they're looking for. Nobody said any. Well, they haven't had any results, I don't suppose.
Okay. So you're right in that you did have this collapse episode at home. I mean, it sounds very much from your wife's description about everything that happened that you actually had a fit.
A fit, yes. A fit. I mean, when you say a fit, what is it you're sort of meaning? I mean, you know, I always think of animals and puppies having fits and things. I mean, is this a mental thing?
No, not. Well, it depends a bit what you mean by mental, but basically what's happened is that you've had this collapse, and then you've had this sort of shaking episode on the floor, if you like.
Yes.
And then afterwards, it took you quite a while to sort of come back and be back to rights and back to normal, really.
Yeah.
So animals, they do have fits, and other people can have fits as well, but that certainly sounds as though that's what happened to bring you into hospital. Right,
okay. And do the test results sort of confirm this?
Yeah, so really the important thing for us is the description, a really clear, good description that your wife gave about what happened, so that she saw that you had a fit. And then when you came into hospital, our sort of job was to find out why that had happened. So if there was any problem that had caused it, if you like. So you mentioned that you had a scan and that you had some blood tests and stuff. Okay.
Yes.
And so those investigations were all okay, actually.
Oh, good.
Yeah, so the blood tests were okay.
Right.
And the brain scan was okay.
Good.
That means that we've not seen a particular problem that might have caused you to have the fit.
Oh, right.
So sometimes, for example, if people's blood tests are a bit off, or if they have a problem in the brain, like something nasty like a tumour, that can cause them to fit. But we've not seen any of those problems in your case.
So you've not actually found any. Well, like you said, you've not found any problem at all.
So we've not found the reason why you've had the fit. So there doesn't seem to be anything that's caused it. But you certainly sounds as though you have.
But I've had it. Oh yeah. I had a slightly, about a little bit earlier, sort of a little bit faint. But I mean, that was just home, and it sort of quickly passed. I don't know if that was any connection.
Was that before this episode?
Yes.
Okay.
Yes, a little, a few days or so before. But I mean, that was nothing, neither here nor there. I just thought, must have moved too quickly or something,
So did you collapse on that?
No, nothing like that. It just cleared. I didn't think anything about it.
Okay.
It was this one. But I mean, in a way, you say you can't find a reason for this, but I mean, is it possible that it could happen again?
Yeah. So have you ever heard of the term epilepsy? Have you ever heard?
Oh
of that?
yes.
So in the condition epilepsy, people can have fits, and there's not a particular reason like we found with you. There's not anything like a tumour or any funny blood tests that are causing it. It's just something that happens to people. Like some people end up with diabetes, some people end up with heart problems, some people can end up with epilepsy.
So you think this might be epilepsy then?
I mean, it sounds to us as though that's potentially what the problem is in that we've not found any reason why you've had the fit, so there's no problem that's caused it.
Would I have to be on, these injections and things?
Well, what epilepsy is normally dealt with by neurology or brain and nerve doctors.
Yeah.
Okay, and they're sort of specialists in this field. It's not always necessary to be on tablets straight away if you've just had one fit, but they'll need to do some more tests and then to review things and to decide really the best way to sort of treat you for this.
Yeah. Okay. So I'll be stopping in hospital some longer time, will I?
Well, you don't need to necessarily stop in hospital for all those tests,
Right.
but what we do need to do is to hook you up with an appointment to come back for them, and also an appointment to see the neurologists, to discuss things and to discuss about treatment and all those other things, really.
Right.
So they're the ones who are going to be able to talk to you about that in more detail.
So, I mean, it's just happened the once. I mean, what about the job situation? Because, I mean, as I said, when this happened, I was at home when I collapsed, which was fortunate. I'm actually a minicab driver, and obviously I wouldn't want this, if any chance of this happening, obviously while I was driving, would it? But equally, it's my my living, to support the family and everything. Something I need to do. I mean, can you sort of, in any way from your tests, predict whether it might happen again or just a one-off?
Unfortunately, we can't, not with the information that we've got available, and as you've sort of said and as you've highlighted, it would be potentially a very serious situation if you were to have another fit, particularly a fit when you were driving.
Yes, yeah.
And for that real reason, there's some rules and regulations in place regarding driving after you've had a fit. And that's something that I've sort of got to talk to you a bit about now, if that's okay. Mm-hmm. So the DVLA, or the people who govern our driving and our licences, say that after you've had a fit, you can't drive straight away afterwards.
No.
And it's really for a minimum of 6 months, depending on some of the investigations, but potentially up to a year after you've had a fit before you can drive any sort of vehicle again.
Well, I mean, that's bad news for me and, my job, because as I say, basically, as a minicab driver, I'm self-employed.
Yeah.
I know we have these names on the side, but I mean, that's purely booking. Effectively, I work for myself. No driving, no money coming in. So who would tell the DVLA? Would I have to tell the DVLA?
Yeah, so it's your responsibility to tell the DVLA that you've had a fit and so that you're not able to drive. Okay. And then what we would do is we would write to your GP and inform your GP, obviously, that you've been into hospital with this problem, so they know where things are up to. And clearly you'd be going back to see the neurologist anyway.
Yes.
But it is a legal requirement. It's not just sort of our rule. It's not something we've made up.
No.
It's a legal requirement from the DVLA that you aren't allowed to drive after you've had a fit.
So yeah. I mean, do you think it might be worth? Oh, I don't know really. You can see my problem, can't you? That as a sort of the main wage earner and everything, and it is a very, very difficult one how to do, because I'm not quite sure what other work I could do. If I wasn't driving at all. I mean, I don't know. I mean, would it be worth me, if I continued driving and seeing if I don't know. I don't know what to do.
That definitely wouldn't be a good idea, and isn't something you should do. As you said already, it could be very dangerous if you were to drive and have a seizure. You could have an accident and hurt yourself and other people.
Yeah.
So you really mustn't drive, and if you were to drive, then you'd be going against those regulations and you'd be invalidating your insurance and everything. So it's a very serious situation and really isn't something you should contemplate doing.
But equally I would say it's a situation I can't see my way out of, given the sort of time scale. You say 12 months, did you say?
Up to 12 months. It depends really. You have to be it's a minimum of 6 months depending on some other investigations that the neurologist would do.
Right.
But obviously if you were to have a fit in that period, then it
to start all over again.
Yeah, exactly.
The long time scale.
and it's purely for a safety reason. That's all the rule's there for. It sounds to me as though the main concern about not driving is because of your work.
Yes, that's that. I just don't know what to do in this situation. You know, where am I going to go? Or, you know, I mean, I can only think I'll have to try and find some other job if that's the case.
Well, I'm probably not the best person to advise you about specifics, but I can put you in touch with our social work team who can direct you, you know, where you might go to sort of think about the right sort of benefits while you're unable to work, and also in time to think about, you know, what other work you might be able to do and whether or not that would involve, you know, retraining in a different field. But you know, that's quite a big sort of thing to be thinking about, obviously. And
something I'll have to think about, though, isn't it, really?
They can certainly help you and direct you in the, you know, the right place to go and find out the information you need, and the sort of the support that you need while you're unable to work.
Well, I'll have to do this, and maybe some of my mates and, you know, other drivers and people have contacts or so, or, you know, I'll have to do something to get money coming in, and equally I don't want to risk the licence or anything, so right, okay, well that is not, you know, I'm glad you've not found anything in that sense, but equally it's a little bit vague in the sense we don't know whether it's all going to happen again, but I'll just have to wait and see.
Okay, so to just sort of quickly summarise the points I've made, I think that's important, is that you've had this fit and we think it might be that you've got a condition called epilepsy. So for that we're going to be referring you to the neurology doctors who are the specialists in this, and will talk about other investigations and treatment. And the second important point that we've covered is that the fact that you can't drive after a fit, and that's a you know a regulatory requirement. The other thing that I just want to quickly sort of run through with you is about other sort of safety things if you know with fits. And there's obviously some situations where to have a fit would be much more serious than others.
I suppose, you mean banging your head and things.
For example, I think particularly until you've seen the neurology doctors and we know where things are up to, you should be a bit, you know, extra careful. And so I would advise, don't put yourself in any situation where if you were to have a fit, you would come to harm. So don't go doing things like climbing ladders or trees or you know,
no, I wouldn't do that.
Would say to be very careful about things like swimming on your own, or to go into if you were to take a bath, you know. You
mean an ordinary bath?
An ordinary bath, because you know, if you were to have a seizure in the bath and no one was able to get in to help you.
Oh, crikey. Well, I'll stick with showers then. I should be all right with that, shouldn't I?
Yeah, so I would just, you know, when you're doing things, I don't want to alarm you, but at the same time, I want you to be safe. And so just be thinking about things and you know, when you are doing things, just have that in the back of your mind and try not to put yourself at risk. So I would say particular care about climbing to heights, not to do that. And about things like bathing and swimming pools, those sorts of things. Just so if anything untoward were to happen and you to have a seizure, you know, you wouldn't be putting yourself or anyone else in danger.
Okay, well I'll bear that in mind and we'll see what happens.
All right.
Contact the DVLA.
Okay. Good.
Okay.
Is there anything else you want to ask me at this time?
Not at this stage, no.
Okay. All right.
Thank you, Doctor.
Okay, thank you.
Okay, thanks very much, Helen. That was very nicely done. Could you just quickly summarise for me the key points in your discussion?
So I think there were two elements to this. One was explaining the diagnosis of epilepsy and the fact that the gentleman was going to have some more investigations, potentially some treatment or not, and also to be seen by the neurologist. So there was one element. And the second element was really the issues regarding safety. So the issue of not being able to drive and potential implications of that for his livelihood and his family, and also other safety issues, you know, such as what I mentioned about the swimming pools and the ladders and things.
Okay, thank you very much. And in relation to the safety issues, so driving being the most important, obviously, which of the ethical principles do you think relate to that?
I think the one that strikes me as relating most is the non-maleficence principle, so the principle to do no harm. Obviously, if you're allowing someone to drive after, and you know, who could potentially have a fit whilst driving, they could cause a lot of, you know, they could kill themselves and, you know, do the same to other people. So I think that's the one that I think it highlights most markedly is not to sort of expose the patient or the public to that risk.
Okay, thank you very much. Had he insisted that he was going to drive, how would you have handled that?
Well, I think I would have made sure that he understood my explanation and the reasons why, that it was a regulatory requirement rather than just our rule, and made clear that he would be invalidating his licence and his insurance were he to drive. If he was still insistent, then I'd already told him that we'd be informing his GP. Sometimes it might be helpful to try and involve his family. They might be able to persuade him a bit better. But if despite all that he was still insistent, then you'd be duty bound to inform the DVLA on his behalf. And that's really for a principle of safety, obviously for his own and the general public's safety.
Okay. And if you got to the point where you thought you may have to breach confidentiality and do that, is there anyone you'd speak to first?
Well, obviously I'd be speaking to my seniors, to make sure that they were in agreement. And it might be appropriate to contact someone like the MDU for advice and for direction in that situation. But certainly involving my seniors and the patient's GP and his family would be important as well.
That's great, thank you very much. In an information giving scenario like this, it's important to explain the diagnosis, the prognosis, options for treatments and potential complications. Here the diagnosis was of epilepsy, and the treatment was going to be dictated by the neurologists, so it's important to acknowledge that and convey that information clearly to the patient. The complications relate to driving, and here it's very important to be clear and firm and not to allow the patient to negotiate with you.